Have you ever stopped to wonder how COVID can affect people mentally? Do you think something should be done about it? COVID has affected people in many different ways. John Oliver, last week tonight, has done many segments on his show about it. In some of his segments, he talks about different solutions to the problems he's covered. It's just as important to treat the mental health side of COVID as is to the medical part. When patients enter the hospital with the virus, they get the help that they need. But when someone starts to have mental issues due to COVID, it could be because they could have lost their job, can't do their favorite hobbies, they can't socialize with people. It affects them greatly. When it affects people financially, they need to get the help that they need. But when it starts to affect them mentally, that's where society and the medical profession drop the ball. Treatments have been cut. Treatments are not available to them. Patients are unable to get the help that they need. We should set up programs for these people so they can get the proper help. These programs will help people in the future if something ever comes up. It's just as important to treat all sides of this matter. After having some family members who had the virus and were treated medically, some of my family has been affected by this virus greatly. Some family members of mine had developed depression, they can't work, get the help that they need, or overall see a professional. This matter should be treated equally, both medically and mentally. Mental health is just as important as getting the medical help that you need. Patients should have access to help, therapy, medicine, and any other stuff that can help them in their recovery. COVID has caused people to develop severe depression, and maybe they can't work, do what they like, or go see family. Families have been affected by the virus too. They can't see their families, go talk to them, or they're sick in the hospital. Programs should be set up to help these people get through this tough time. In conclusion, if you do your research, it's just as important to treat both of these issues equally. In my opinion, both sides of the issue should be treated equally.